Well, I know we'll probably have some other folks joining us, but we can go ahead and get started. For those of you I haven't met, although I know most everybody on the call, I'm Amy Lewis. I'm the Chief Development Officer and Vice President of External Affairs here at PPT&M, and I'm excited to welcome you all tonight. We're going to hear some great information from Ashley and Francie and Isabella. Also wanted to name that our Director of Education, Victoria, is on the call. So when we get to Q&A and things like that, if you've got any questions for any of us, we're happy to jump in and tell you what we know. All right. All right, Ashley, take it away.
Well, hi, everybody. It's really good to see you. Really good to be together. Thank you for joining for this happy hour. I'm just going to update you a little bit, just for a couple of minutes, about healthcare and sex ed. And I'm happy to have Victoria with me to talk about that. And then we'll move into some advocacy things. It's legislative session. It's an election year, so we're going to spend the bulk of our time on that. But I wanted to let you know about healthcare. We're really proud to be in our second year to be open at our Knoxville Health Center, which is our brand new health center in Nashville. We are making plans for an upgrade to our health center in Nashville, a major upgrade. So more to come in Nashville. We're really excited about that. You'll be hearing more soon. And of course, we have both of our health centers in Memphis. We temporarily closed one of our locations in Memphis because we got defunded from Medicaid. That's TennCare in Tennessee, and that's thanks to Donald Trump and his cronies in Congress, who did that in July. And I blame everything on him. Anything that happens, I blame on him, and it's usually correct. And it's a 1-year defund from Medicaid, and we fought it in court, and we didn't win. So we're stuck without being able to see TennCare patients. That hits Memphis the hardest. So we're kind of experimenting with location and hours, and we've reopened our Summer Avenue location in Memphis 1 day a week, and we're going to move up to 2 to 3 days a week soon, once we get our staffing back in place. So, and also, we continue to do telehealth statewide, and we continue to do PP Direct both in Tennessee and Mississippi. We do it statewide in Tennessee and statewide in Mississippi, and that's our app, where you can get asynchronous care, meaning you can talk to the provider over the app and you don't have to have a video visit, and you can get birth control, UTI treatment, and emergency contraception mailed directly to your home. And we are seeing thousands of patients through that app, and we're really proud of that program. And one of our donors who people in Memphis and Oxford know, it's Dr. Owen Phillips. She raised her hand and said that she wanted to volunteer on the PP Direct app, which we're super excited about. She's a volunteer physician. And so she's seeing patients from Tennessee and Mississippi now on the app, and she's all trained up. She had to do hours of training, even though she's an OBGYN and has been doing birth control for years and years. That's just a Planned Parenthood thing. But she did it, and she started seeing patients. Oh, she'll start seeing patients tomorrow. So super excited about Owen. She joins this group sometimes. Love her. She's a former board member also. We got our Title X funding back temporarily, which is such a weird, crazy thing. The National Family Planning and Reproductive Health Association sued the Trump administration over kicking family planning providers, not just Planned Parenthood, but other providers, out of the program for bogus reasons. And they won. But we just have it temporarily. We have it for January, February, and March. And then the program has to renew on April 1st. And we feel like they're going to give us an application to continue that will have a poison pill in it that will make it impossible for Planned Parenthood to continue. We'll see. The application was supposed to come out a month ago, and it hasn't even come out yet because they're such a disaster. But we're so glad to have that money temporarily to provide free services to our patients at all our locations. We have some new services we've launched. We're treating perimenopause and menopause symptoms now in our health centers at every location. We started on February 2nd. So if you have those feelings like I do, like you need some hormones for menopause, you are welcome to come to Planned Parenthood. And we're really trying to fill a gap, especially for uninsured women who may need an affordable place to go to talk to a provider and get care. We added vasectomy services to Knoxville this month. We've been doing it in Memphis and Nashville For a couple of years, we added it to Knoxville, and we saw 4 vasectomies this week. Yeah, Monday. We did four. We had 5 patients sign up, and we did 4 vasectomies that day. One person chickened out and didn't show up, but we got 4 other folks done. And we're really seeing a lot of LGBTQ folks through our vasectomy program who feel safe coming to Planned Parenthood, and we're really excited about that. We have some other service expansions coming. We're doing some expanded telehealth, more to come on that. We're also offering an initial prenatal care visit, more to come on that. What we're finding is that patients are having a hard time getting in to see an OBGYN statewide, and they need that first visit to get their labs and their ultrasound and get started on the right track for a healthy pregnancy. So that's going to be on our list as well. I am happy to announce that we found out today that we got a $50,000 grant to launch our virtual sex ed programs. And I'm really excited. It's a program we've applied through this avenue of funding for years and years. Amy and I were just laughing that I think this is like the 10th or 11th time that we've applied. It goes back to like 2014 or something that we've been applying. And this year, because we had a great proposal from Victoria, we got it. And we're going to be launching a platform for this asynchronous virtual sex ed. And that's what the grant was for. So folks across our region can get comprehensive sex education. Victoria, do you want to jump in and say anything about that now? You want to say
Sure.
anything? Yeah,
Yeah,
what are
I'm
you going to
happy
talk about?
to.
What are you going to talk about
Yeah,
on
I'm
these
happy
platforms?
to. So we basically sort of came up with this idea. It is something that is really revolutionary across all of the affiliates. Just generally the sort of asynchronous model of allowing folks access to this type of education is not something that's being done. It's really only a model that's being used at one other affiliate, and that's being done very successfully. We really have the opportunity to be able to provide education into the space that is particularly geared towards folks that are in the South because I don't want to say our problem set, right? But the challenges that we face here when it comes to sex education is incredibly unique. And so this really offers us the opportunity to be able to offer everything from professional education trainings to professionals, caregivers, faith leaders that are working out in the community, all the way to like young people, right? K through 12 that their parents are looking for age appropriate information for them that they're not getting through the public school system. So it's going to be great for a lot of our rural communities. And it's hopefully something that we'll be able to potentially make a little bit of fundraising money off of, which is another huge positive of the program. So we're really excited about it.
And happy for you that you got this grant for this program, Victoria.
Thank you.
Last thing I'll say is we've got our Standing Strong fundraising events coming up. Memphis is next week on March the 5th at the Botanic Garden. I'm excited. I sent my list of my guests that are coming. My husband and I sponsor every year, and I sent my list of guests in today, and I'm excited. My parents are coming. They're driving over from Hot Springs, Arkansas. My brother will be there. He's driving all the way from his condo downtown in Memphis to the Botanic Garden. So really excited about that. And then on April 16th, we'll be in Nashville at the Fat Bottom Brewery. And in Knoxville is on May 19th at the Knoxville Museum of Art. So a new location for us this year. That's exciting. That's such a beautiful place to be. So look forward to seeing you all soon at Standing Strong. And now I'm going to introduce Francie Hunt, who is PPTNM's Director of Advocacy and Organizing, and also our Executive Director of Tennessee Advocates for Planned Parenthood, as well as Isabella Bartolucci. Isabella, you're going to have to name your title because I think I'm going to get it wrong.
Legislative lead.
Our legislative lead. I was going to say that actually, and then I got nervous that I was going to get it wrong. So I'm going to turn it over to Francie and Isabella to talk about what we're doing right now in our advocacy.
Great, great. Well, I'll just be very brief and I'll turn over the bulk of this presentation to you by Isabella. But just to kind of set up the context for the work, Isabella's going to talk about a lot about the season that we are in, which is the legislative season, but to kind of show you how the legislative work fits into the overall advocacy and organizing strategy. Our view is that at the end of the day, all of our advocacy and organizing is centered on making sure that we're able to improve people's lives. We want to make sure that we have reproductive freedom and that, we're using our voices in a powerful, effective way so that we can get those things. And at the heart of it, we need to be building, leadership. So, there are kind of three ways in which we work to cultivate leadership to make an impact in everyday lives. One aspect of the work is working on community organizing, grassroots organizing. So we have a lot of advocacy education that we do. In fact, tomorrow we have a legislative update. So you're actually getting it tonight, but for the other folks, we're going to help orient folks to the bills that are happening this year. So we have a lot of educational pieces for our grassroots. We build up action councils and impact circles, which are ways that we can support reproductive freedom oriented volunteer leaders on the ground to build out their own networks. So that's a lot of what we do. And then the other kind of the second part of the work that we do is work on elections. We are in an election year. We're in the middle of, the filing deadline for candidates was on Thursday of last week. So we're gearing up to send all of those candidates our local candidate questionnaire. So we will be vetting candidates to take up local election endorsements. And then we'll pivot towards the end of the year towards state races. So all of that, we're building power in those areas and we're getting ready for elections. And so the third part of this triangle, so we have grassroots organizing, building our community, then we have elections. And then the third part of this triangle is our legislative work. So we can pass really great policy. So I think in that context, I want to turn it over to Isabella so you can see a lot of the work that we're doing this year.
Hi, everyone. I'm going to share my screen to give you guys some visuals while we chat. Can everyone see okay? Great. Okay. So usually I don't get to start off with a really fun, exciting bill. So this year we are so excited to announce we have the Maternal Health Care Protection Act. So this is a Planned Parenthood bill. We created it. We got our sponsors. This is our bill through and through. We are championing it. So this bill came out of, I don't know if y'all remember, but last year Tennessee passed the Medical Ethics Defense Act, and that basically made it so that any healthcare provider, not just doctors, but any healthcare provider could deny care for any patient for pretty much any reason based on moral, ethical reasons, not just religious reasons, as it was previously in the state of Tennessee. So the Medical Ethics Defense Act passed, and then subsequently last summer, a woman in East Tennessee who had been with her partner for 15 years, they had a 13-year-old child together, they got pregnant. And we're so excited to be having another child. And she made an appointment with her OBGYN in Jonesboro, Tennessee, and her OBGYN decided that in light of the Medical Ethics Defense Act, she did not want to treat that woman and care for that woman's pregnancy because the woman was unmarried. That was just, she chose to deny that woman care, and that doesn't sit right with us. So we wanted to do something about it. And so that's how the Maternal Health Care Protection Act was kind of born out of this idea that, no patient in Tennessee should be denied necessary and life-saving prenatal care. So we're thrilled. This is just so fun. We never get to start off with a fun bang like this. So it's really exciting. So our sponsors are Representative Afton Bain and Senator Charlene Oliver, and we have kind of a multi-pronged strategy with this bill. Obviously we want the bill to pass. Our number one goal is protecting pregnant patients in the state of Tennessee, but we specifically chose this avenue for this legislation because, we have a strategy here, and there's specific things we want to do with this bill in addition to hopefully getting it passed and protecting pregnant patients. We are specifically running it through the Population Health Subcommittee on the House side first, and that is our avenue because we have electoral goals with this as well. Representative John Gillespie in House District 97 in Memphis sits on the Population Health Subcommittee, and we strategically want to get his vote on this. We will be playing in that district as we played last year or in 2024. So we want to be able to get a vote of his on this. And if he votes no, that's something that we are able to talk about with our supporters and folks at the doors and on the phones. And then the third kind of strategy around this bill was, I kind of want to change the message about how people think of Planned Parenthood. With Planned Parenthood, parenthood is in our name. It's a capital Planned Parenthood. And we kind of want to reclaim that, right? A lot of folks, especially when we're talking to everyday Tennesseans, they're like, oh, you guys do abortions. And it's, we're reframing that. We're actually out here with our full chest protecting the rights of patients to be taken care of when they're pregnant. So we're really excited about it, and we hope you all will join us for this bill. We're saying it's our bill because we want everyone to feel really included in this and feel like they're a part of it as well, because it really is a joint effort. And we have put a call out for all 99 House members and all 33 senators to join us in co-sponsoring this bill. In theory, it should be the most bipartisan bill to ever go through the state of Tennessee, as we are such a pro-life state, and what's more pro-life than protecting our pregnant patients. So we're thrilled about it. If you guys want to have an action, if you guys want to call your representatives and senators, we welcome that. But so it's exciting. We're starting off with a bang. And then the next bill, this is our other one that we're championing this year. This is prohibiting ICE in physicians' offices and hospitals, from Representative Gloria Johnson and Senator Sarah Kyle. This one hasn't had much movement yet. It's a new bill that was introduced this year. We have a lot of bills that have been rolled over from last year because we're in the second year of our 2-year session. And this bill, it's kind of what the title says. It would prevent branches of the U.S. Department of Homeland Security from coming into physicians' offices and hospitals. So, we don't want that to happen, so we are pro this bill. And now we go into the bad bills, so to speak. So this one, I'm sure a lot of folks have seen this. It's been in the news recently, the abortion patient execution bill. It has a very scary name, which don't let it take you down a rabbit hole, but House Bill 570, this is from Representative Jody Barrett and Senator Mark Pody. So the good news is they don't have the votes for this bill, and it will not be heard in committee, which is great. I mean, my opinion is that these bills shouldn't even be introduced, right? Let alone not be heard. Like, Mark Pody said that he doesn't have the votes to have it be heard in committee, but we shouldn't be introducing these bills to begin with. So we are vehemently against any bill that's going to, potentially execute abortion seekers. So not great on that one. Next one, this is House Joint Resolution 7. This is a rollover from last year, but we haven't discounted it yet. It's personhood at fertilization. So this would amend the Tennessee state constitution to provide language that says a fetus is a person. This one has stalled as of right now, but again, we're not going to fully discount it. We will continue to track it until the end of session, or it has been voted down. Next, we have House Bill 5. So this is the abortion pill intimidation bill version 2. So this is a bill from last year that has a little bit of complicated history to it. So it's a Gino Bolso, Joey Hensley bill. This bill was originally, in its original form, brought as House Bill 26 last year, which was an abortion pill intimidation bill. It was going to make it so that you could not transport abortion pills into the state. And the bill was very poorly written, and it was exceedingly vague in what it meant to transport. What does that mean? Does that mean mail carriers? Does that mean my mom carrying pills across state lines? The bill was unclear, and he couldn't get the support to pass it. So that bill was not moving forward. So what Gino Bolso did was he took language from House Bill 26 and brought it onto an amendment to House Bill 5. House Bill 5 was originally a very kind of interesting, almost benign, bipartisan bill about tort reform. It was kind of just a legal tort reform bill having nothing to do with abortion. But so this bill was flying through committees. It was voted out of the Senate floor. And then, so what Gino Bolso did was he took language from House Bill 26 and added it as an amendment to House Bill 5. So that's how we became in a little sticky place with House Bill 5. So what the bill does in its current state is it outlines civil penalties up to $5 million for sending abortion pills into Tennessee. So not great. But it does exempt pharmacists, physicians, motor carriers, freight forwarders, and air carriers from the civil action outlined in the bill. So it's just, this is another scare tactic bill that we see all the time now. But we're hoping it has some movement, so it will be heard in March 3rd in the Health Committee. So we'll keep everyone updated as that one moves forward, but it has already passed the Senate, unfortunately. Next up, we have House Bill 754, the Gender Affirming Healthcare Requirements and Reporting Act. This one is another carryover from last year from Representative Jeremy Faison and Senator Brent Taylor. So this one kind of stalled out last spring at the end of the last session, and it has not been picked up again this session, but it is still live. So we will keep an eye on it as things potentially move forward. But the caveat being that Senate committees are already closing this week. Like, we're in election year, as Francie said, they are trying to get out of there as fast as possible. So it kind of has an uphill battle to potentially being passed this year, given the fact that it hasn't moved so far. Next, we have House Bill 2498. This prohibits the Prohibiting TennCare Coverage of Gender Affirming Healthcare Act. It's a Kip Capley and Adam Lowe bill. So this one has passed the TennCare subcommittee, so it is moving forward. And this bill would prevent TennCare from providing coverage or reimbursements for gender affirming healthcare, both in person and via telehealth. So we're keeping an eye on this one, and we'll keep everyone updated as it moves or, fingers crossed, stalls out. Next, we have House Bill 2290, the IVF restrictions bill. This is Representative Ryan Williams and Senator Paul Bailey's bill. Ryan Williams kind of has a newfound passion project of bringing all these kind of complicated IVF bills. He brought one last year that was quite interesting, one could say. The bill, as he presented it last year, was going to make it so that if a family was starting to do in vitro, they had to declare to the state the number of children they wanted, right? Like when you start, you had to decide how many children you want. Do you want one child? Do you want 6 children? You had to give them a solid number of wanted children. And then the state would only allow you to create 4 times the number of declared children in embryos, which is kind of insane. But thankfully that bill did not pass, but he is kind of on this IVF journey, so to speak, for some reason. He feels called to this. So what this bill would do, this version of his IVF bill this year, it would require that physicians and practitioners providing assisted reproductive technology, including IVF, acquire specific certifications for these services. So practitioners who are practicing ART are already highly trained and qualified and do not need another certification process. So this bill is really unnecessary and just added red tape for folks who are looking to expand their families. So we're against it. It has been placed on Population Health Subcommittee, but we don't have a date for it yet. But as committees open up next week, I imagine we'll start to see some potential movement on this one. So next we have House Bill 1784. We are calling it the Forced Birth Celebration Act. So what it would do, it would establish an annual anti-abortion holiday in Tennessee called Sanctity of Life Day on January 22nd, which, as we know, is the anniversary of Roe v. Wade. So this is another Gino Bolso, Joey Hensley combo special. I don't know if you guys have picked up on a theme here with some of our legislators who are obsessed with us. But yes, this is Sanctity of Life Day. It hasn't moved so far, but we'll keep everyone in the know as it potentially moves. And then lastly, we have 1472. This is banning Bostock and permitting discrimination bill. It's a Gino Bolso bill, this time with Senator Janice Bowling. So this bill would ban Tennessee courts from using the reasoning behind the Supreme Court case Bostock versus Clayton County when interpreting state or local laws related to sex discrimination claims under the Tennessee Human Rights Act and relevant local laws. So there is kind of a theme the past few years. I'm sure some of you guys will remember the Plyler bill that was brought up last year that would have prevented undocumented students from attending public schools, which was decided in the Plyler Supreme Court case. So a lot of these bills, specifically Gino Bolso bills, are attempting to undermine Supreme Court cases in hopes that, this bill will be passed in Tennessee and then it will potentially make its way up to the courts to the Supreme Court. So there's a number of those bills that we have kind of floating around this year and last year, unfortunately. So those are all of our bills. Do we want to swing to questions, or does anyone have comments, thoughts?
Maybe stop screen sharing, and if that way folks can see everybody. Thanks, Isabella.
So I have a question. So so Gino Bolso, is his journey PPL, or is his journey both PPL and reducing women's rights? Like what is his, just so I better understand, I'm sorry, what is his cause? Does he argue? Anyone?
What is PPL?
I mean, so is his mission to dismantle women's rights?
Yes.
Basically? Okay.
Yes. Yeah.
Okay.
He's coming from a very like Christian nationalist perspective.
Okay.
So that's a very kind of unique Christian perspective.
Okay.
And I think, it's actually getting a lot of traction online. All of these kind of coupling all of the in vitro, like personhood, get rid of birth control. All of those things are connected. I think I think it's starting to become more visible because I think for a lot of folks, they thought, well, since they won on abortion, maybe they'll, go away. And now they've continued, being as strong as ever.
Okay. Thank you.
Yeah.
He's also a lawyer as his like day profession, so I think for him it's almost like sport,
Okay. That's what
fortunately.
it kind of looks that way visually.
Yeah.
Sorry.
Unfortunate. One could connect those dots, yeah.
Hmm.
Isabella, could you talk a little bit about the field trips to the Capitol and how those are going?
Yeah, I'd love to. So we actually have one tomorrow that we're super excited about. So we run this program called Field Trips to the Capitol, and it is exactly what it sounds. We do a field trip to the Tennessee State Capitol in Nashville, and the whole point is the Capitol is intentionally a really intimidating place. It is literally on the top of a hill. If you come from the area with free parking, you have to, do 1,000 steps to get up top of it. It's very confusing. It's intentionally really like complicated and intimidating. So we try to dispel that. And this is probably one of our like most well-attended recurring tentpole events that we do. So we bring people to the Capitol. We make it really low barrier to entry. We do a Civics 101 training for folks who either didn't learn it in Tennessee public school or didn't grow up in Tennessee. So we do a refresher on Civics 101. We make it really fun. And then we do a lobbying training and we show folks how to use the Tennessee's state capitol website, which, fun fact, I always like to joke that the state of Tennessee is kind of a mess, but our capitol website is award-winning, which is so funny. But if you go to capitol.tn.gov, we have a very well executed Capitol website. So we show folks how to navigate that so they can learn to track bills on their own if they want to, and how to find and reach out to their state legislators. And then we do a tour of the Capitol. So we kind of do the tour of the Capitol in our own words. So Tennessee has a kind of interesting and it's an interesting backstory. We are the reason that we have women have the right to vote. So we talk about that in the Capitol tour. We get to show folks like all the kind of interesting niches to the Capitol. The architect is buried in the walls. There's like multiple people that are buried in the walls of the Capitol. So it's a fun time. It's always it's nice. It's a great entry point to bringing people to the Capitol. And the best part is they always come back. Like once we bring them to the Capitol, they're like, "Oh, this was so easy. I was expecting this to be so weird and complicated and not fun." But then they come back and we see those same people coming to committee hearings and they kind of look to us for how to get more involved, which is really lovely.
And Isabella also has been leading on the campaign crash courses, which we've been doing all across the state. They've been wildly popular, and it's basically helping individuals learn how to run a campaign. It also helps candidates learn how to run a campaign, every bit of it. How to develop the strategic plan, how to run field, how to fundraise, all of the bits and pieces. So Isabella's been really instrumental in helping build up our power base through education efforts.
Yay.
And the most recent one was in Chattanooga, correct, Isabella?
Yeah.
Our first one there. And how
Oh,
many, is that,
Montgomery, actually.
So
oh,
we've
we've had
we've
one
done
since
them.
then.
Yeah, we have
That's
completed
right.
all the major cities. So we did Memphis, Nashville, Knoxville. We did Chattanooga, which was one of our best ones. We like those people in Chattanooga are fired up and ready to go. Um, and then we did Cookeville, so Putnam County, and then we also did Clarksville, so Montgomery County, and then we have our last one for the season in Wilson County, in on March 21st. And Wilson County, to their credit, they are a recruiting powerhouse, so they decided that they wanted to recruit um, for county commission seats, and they filled 24 of 25 county commission seats and all the school board seats with Democrats and pro-choice candidates. So we are so thrilled about it. And because of that, we reached out and we're like, hey, do you guys want a campaign crash course out in Wilson County? Like, we see all the hard work you guys have done. Would it be helpful for you all if we brought a campaign crash course out to you guys and tailored it to running in local races? So the enthusiasm is so high, especially in Wilson County right now. It's so exciting.
And Karen Reynolds, who's on the line and also one of our board members, she was one of the judges for, because the students, what they do is they go into teams, they actually have to create their own campaign plan and they present it on Sunday with their team before a panel of judges, and it's called Campaign American Idol. So, and then they get a trophy, which I think is right behind Isabella. You can see it right over your shoulder.
They win the teeny tiny trophy award.
And Francie, if you don't mind me jumping in to make a connection, one of the things I love when we talk about Wilson County and how activated they are, and Karen Brinker, who was one of the founders of our Action Council out there, and now their intent to run and their success with running all these candidates is the through line of how much advocacy and organizing matters. Because Karen Brinker, who's one of the founders of Wilson County, saw online on our social media that Francie was walking across the state a couple of years ago. She joined Francie for a week, became extremely activated, started an action council, recruited all these people. And so it's this building, and being able to see the foundation and the bricks being built up is really what's so powerful about the work that Francie and Isabella are doing.
I love that you connected that, Jessica. And I'm so proud of Francie for this, for her vision and her years and years of really hard work. Going back to the walk, I mean, Francie was doing this work before the walk, but the walk has been really an interesting through line. And Francie's written a book about her walk across Tennessee, and she's working on getting it published. And I had the privilege of getting to read a draft of the book, and it was I cried through through most of it, just kind of reliving uh, what an incredibly emotional time that was, and that Francie walked across the state to talk to people about how they were feeling in 2022 and documenting that. I had no idea you were documenting so much while you were doing it.
Oh, yay, Karen, that sounds fun.
Thanks, Karen. I love that.
What other questions do y'all have? We've got folks here and we're happy to answer for you.
Well, we did miss a question early on from Karen, and I wanted to make sure that we answered it. Karen's laughing over here now. But no, I wanted to make sure we answered that. And Jackie, I love the idea of pre-buying copies. So I'm going to let you and Francie figure that out. That sounds amazing. Karen, way back at the beginning, you asked about taking TRICARE or other government insurance as it relates to our healthcare. Ashley, do you want to talk about insurance, Medicaid, TennCare, et cetera?
Yeah, we do take people's commercial insurance and we take TRICARE and we actually take Medicare. Also, we don't see a lot of Medicare, but sometimes we'll have a dual eligible Medicaid, Medicare person. So we take every insurance we possibly can and we try to get into every network we possibly can. Um, did that answer the question?
I do think that there might be some reservation that we may think if you can't use Medicaid or Medicaid that we also banned us from using our federal. Like I have federal insurance,
Oh,
Charlene has federal insurance. So part of me thought that that was part of the pot of not being allowed. And I
that
think
is such a
maybe
good question, Karen. That is so insightful. No,
and
it is the bill that Trump signed was specific to Medicaid. The federal share of Medicaid is what has been outlawed.
I think you might want to advertise that a little.
Okay.
Especially for dependents.
Especially what you're doing for dependent women, because there's
Hmm.
a lot of discrimination, like when you go at Fort Campbell
Yes.
and trying to get care for menopause and all that.
Okay.
I
And
mean,
pregnancy or like children.
the early pregnancy, like active duty soldiers don't want to do their first, or spouses may not want to do their first appointment at Blanchfield. So advertising that you do take TRICARE and federal insurance, because I'm even as active as I am, I guess I'm a little surprised. So I know if I am, everybody else is too.
Okay. I'll work on that. Thank you so much, Karen.
Yeah, that's good.
That was actually the first insurance. When I first came to Planned Parenthood, we were a cash, we were only cash pay. When I started in 2013, it was either free or cash. And we had to build, a whole new revenue cycle there to take people's insurance. And the very first insurance we accepted was TRICARE. That was our very first one.
So also giving a year's worth, so they
Okay.
don't have to come back. Like if
Hmm.
I'm going to deploy to Korea or I'm going to go somewhere, I don't want
Well,
to have to.
we're not dispensing hormones. We are scripting those out.
Yeah, but you give
Um,
me the script and I can go get it filled, and I
oh,
don't
you
have
want the
to
script
fight.
for the script for 12 months? Yeah, absolutely. We could
Yeah,
do
I
that.
mean that
There's
makes
no law
it
against it. Yeah.
right. That makes a big difference. It used to be a big thing for active duty women. I
Okay.
think
I'll
starting
give
to
that
work
feedback. Yeah.
starting to
Go
work
ahead.
especially in around Clarksville with active duty women, they're gonna face more and more discrimination. Charlene and I both worked at Blanchfield for many years, and we know the discrimination in the healthcare system there, and making it easier for you might not be able to, a cash pay for it. I will tell you on active duty, if I knew about a Planned Parenthood, I would have happily gone and done a cash pay than go through the system and be slut shamed, even as a senior NCO in the military. This,
I get
this,
it.
so advertising that a little bit more of what that looks like and the rates.
Sure. We can do it. Thank you.
So this is a bit of a layperson question, but so I love that, congratulations on the $50,000 grant. That's fantastic. Um, how do you find your audience? So how do you communicate that this wonderful program is going to begin? So
Well, I will let Victoria jump in as well, but I'll just name that, we have a lot of places where we already do in-person education. So we always start with the folks that we're already connected to, letting them know we have a new option. Our other community partners out there, like for instance, right now we're in the process of doing a community needs assessment in the Memphis area. We've already done them in East Tennessee and Middle Tennessee. And so we reach out to those folks
I see.
to kind of get their feedback on what we're doing, and we will start with them. But we'll have to like work through Francie's advocacy folks. We'll make sure action councils in different counties are aware of it, and then they can start making connections. And Victoria, what other options would you name that we'll be looking at?
Yeah, sure. So, I mean, I think that it's important to name that this is really something that there's a huge need for, right? So, like, there's already sort of an audience that is built in and like waiting for this service to be a thing. We have such a demand for our virtual programming, that we've sort of been I don't even want to say experimenting, sort of piloting in the past year, not only like within the state, but also nationally, right? I think we saw participants from like 23 different states last year. So there is sort of that audience is definitely there. But it's very similar to what Amy said, right? We work all of the current connections that we have within the community, through the advocacy department, also really utilizing like targeted advertising through social media, and just getting the word out there that this is something that's available to our community partners through newsletters. It's really the same work that we do now. It's just sort of like it's going to be, we kind of have to get it up and running and ready to go, and then we'll be able to start getting the word out there that it's available.
It's wonderful.
You know, it is wonderful, Joan. That was such a good question. And I think about the asynchronous care that we provide through PP Direct. It took about 2 years to get like for it to really grow. I mean, you could see if you see each month, more and more people participate, more and more people participate. And now we're kind of at a steady state. And it'll take a little bit of time. But a lot of what Victoria is going to create will be evergreen. So that's what's going to be so great about making this investment.
Fabulous.
Isabella, can you mention our advocacy day this year? It's not far off.
Yes, Advocacy Day is Tuesday, March 24th. So we're very excited about it.
And what's on the agenda that day?
Well, fingers crossed, if the Maternal Health Care Protection Act, we'll get to see it, everyone knock on wood. So potentially we'll be seeing that being voted on, pending it makes it through Pop Health on the 10th first. But we're still figuring out all of our programming, but we are kind of diving into a maternal health theme this year, kind of to piggyback off the bill that we're running. So we're kind of wrapping it all up nicely with a bow for maternal health this year.
And I just spoke with the woman from Jonesboro. Her name is Brittany, and she was the kind of famous woman last year that was denied care because she was unwed. And so she's planning on attending our advocacy day and speaking at our lunch. So, but if you're here in Nashville and are able to come on March 10th, we sure could use as many people as possible to elevate the conversation. And I think what's been interesting about this bill is that it's been, people are having conversations about it as it relates to the abortion patient execution bill and some of the attacks on contraception. So, and then some of you may know, this week also in Nashville, there was a woman who was denied her sterilization procedure because the physician, even though she had paid for it and had gone through all the pre-op rigmarole right before she was actually supposed to have surgery, the doctor decided not to do it because they believed in the sanctity of her. What they call it?
She had an IV in her arm and was literally ready to go and had been waiting for 3 hours in a pre-op room. And it was in an Ascension St. Thomas hospital, and they decided their ethics board canceled her surgery literally after it was already supposed to be performed to preserve that her her sanctity of fertility sanctity.
Sanctity of fertility. Yeah, that was the word. Yeah, which is so we're seeing this theme now where they're denying care because of other people's, religious values, and it's impeding our access to healthcare. So I think people are starting to see how it's all getting tied together because we've always said it was more than abortion. It was never about abortion. It was always about control.
Wait, they said it was sanctity of what? I heard about that, but what did they say? They were preserving her sanctity of what?
Fertility.
That sounds a little bit like, I don't know, wizards and
Yeah.
fairies and stuff a little bit. It doesn't really sound like the Catholic Church, or maybe.
Molly, what's so scary is how they keep coming up with new crazy ways to talk about other people's lives and bodies, you know.
Yeah, I mean, that sounds very
Sanctity of
pagan. Is what I
fertility.
mean is to be like, let's put a crown of flowers on her
Fertility.
head and preserve her sanctity of
Right, right.
fertility. It just sounds like a very odd phrase.
Sacred fertility. I think that was the word they used. Sacred
Oh,
Do
fertility.
you think the men's hockey team gets together and has the conversation of how we should talk about this before? I'm just saying. But they don't talk about men and getting the vasectomy. We don't go through the same thing for men. It's killing me. It's just killing me.
Killing me.
They just really need women to procreate. That's what they need.
I will say that I think young men hear that about vasectomy. There's a young man I know in Memphis who came to us right after we started doing vasectomy in Memphis for his vasectomy care. And one of the things he named afterwards, those that he was grateful, was because we didn't judge him and we didn't try to change his mind because of his age. And he had heard that elsewhere. So now I think, as you get older, no, they're not that interested. But um, I was surprised to learn that he had heard that from other providers, but he was like 32.
We've given a vasectomy to an 18-year-old. He consented and we gave it to him.
Can we not, like, we had those OR suites, for the previous abortions.
Mm-hmm.
And I'm just asking, can we not flip those and do like sterilization for women? I'm just asking, can we not offer that service? I know it's a big change.
Yeah,
But
we've definitely talked about it, Karen. I think it's the options in outpatient settings are not as are I don't know if we're comfortable with that. And I see Dan Pellegrim is here, who started us on our family planning journey in Tennessee. Dan, oh my goodness. I would say he's the father, one of the father of PPTNM that we have today. Welcome.
Yeah, Dan was our very first executive director ever, right, Dan?
I think I was the first. Yes, I think that's correct. Um, I was thinking today about the many extraordinary people that made it all happen. I was there when the decision was made to add abortion services, uh, in 19 right, early after the Roe v. Wade decision. In fact, the board, I remember the board discussion after the Roe v. Wade decision, and yeah, the decision was to go ahead and add abortion services. And I called an extraordinary woman in New York City who had led the Planned Parenthood New York City agency, the Planned Parenthood agency, to add abortion services, a woman named Francine Stein. And I called her up and I said, Frankie, the board just voted to do this, but I don't know what to do. How soon can you get to Memphis? And she said, I'll come help you. So she had done it and helped us set it up, and do the initial steps to add abortion services. It was a pretty exciting time.
Dan,
And
can I?
Dan also fought back and made sure that we could do Title X services and abortion at the same time.
Right. That's what I was going to ask if you would tell that story about you and Eddie Kaplan, who used to be on our board and then
It
later
was
was our lead.
it is one of my favorite stories ever. We You really want me to take a minute and tell that story?
Yeah, if you
I'd
would,
be
that'd be
happy
great.
to. Um, we knew that we were being blocked from somewhere, and our attempt to get Title X funds, we couldn't figure out where. And ultimately, we got two United States senators, Senator Packwood in Oregon, and one other senator, and I don't recall if that was one of the two Tennessee senators, Brock or I just don't remember who the other one was. In any case, we got them to intercede and ask Title X, ask the the administrative branch why we were not getting the funding. And it turns out that a meeting was held at the health department. Dr. Barnett was the family planning physician head at the Memphis Shelby County Health Department, and Dr. Lovejoy was the overall head of the Memphis Shelby County Health Department. And they held a meeting in which Eddie and I were invited, and the two of them were there from the health department, and the federal government's person from DHHS, which I think was still DHEW at the time, from Atlanta. The five of us met in the health department offices in Memphis. And at some point in the discussion, it became apparent that the people blocking Planned Parenthood from getting Title X funds was our own health department. It was Dr. Lovejoy and Dr. Barnett. They were blocking it, and Dr. Lovejoy, or not, excuse me, Dr. Barnett made the mistake of describing to the federal government person that the reason that Planned Parenthood didn't have the funds is because the health department did have Title X funds. And if you were a patient and you had to choose between a Cadillac service and a Volkswagen service, who would you pick? And the federal government person said, "Wait a minute, are you suggesting that the reason I'm withholding funds for Planned Parenthood is because they offer a higher quality service than the health department? And that's a reason for me to withhold the funds. That won't work. That's not a reason." And so we thought we'd hit pay dirt at that point. But then he turned to us, the Fed turned to us and said, "Rumor has it that you're also planning to offer abortion services in the near future. And you will get the Title X funds that you're seeking if you cease and desist on your plans to add abortion services." And at that moment, in my memory, without any hesitation, Ed Kaplan said, looked at his watch and said, Dan, you and I have just been offered a bribe by a by government official from the federal government, and we need to leave here right now because we have a press conference at 5 o'clock. The citizens of Memphis are going to be very interested to know about what just happened in this room. And we got up. Ed got up and walked, and of course I with him, and we walked out of the room. We got out of the room, and I said to Ed, "That was absolutely brilliant." And he said, "Dan, it was a bluff. We need that money." And I said, "I know it was a bluff, but it was brilliant." And a few minutes, maybe a half hour later, 45 minutes later, I was back downtown. We were in the Exchange Building at the time downtown, and on the 17th floor, and my phone was ringing when I got back to the office. I mean, almost immediately after I got back to the office, phone was ringing, and the federal officer was saying, "Don't hold that press conference. You're going to get your Title X funds." It was terrific. It was a moment to be remembered forever. I must say.
Dan,
Uh,
I love you so much. I am so happy that you joined our call today. I think this is like, I mean, it's such a great story about being tenacious and fighting back and not accepting this bullshit that people put in our way. And it was
exactly.
also the beginning of many, many years of us fighting with the Shelby County Health Department. I feel like I'm walking, in your footsteps with all the fights that we've had with
I,
them.
I,
Thank
I'm
you.
sure. I'm sure. I thought as I got on the call, I thought to myself, I don't know whether this group is going to be happy that I joined the call because you could argue that I got you into this mess, but in any case, in any
Well,
case,
we're great. No, we're
bravo for
great. We're
you.
grateful to be in it. We're grateful to be in it.
I have I'm a modest supporter, a modest donor, and I just said to my wife the other day, boy, I think they're that Planned Parenthood affiliate. I really salute. They're doing the right thing and fighting the right fight and doing it under very difficult circumstances.
Thank you, Dan. What a great way to end this conversation tonight. Thank you so much for coming. And thanks, everybody. Thanks, all of our folks from across the state. We are well represented tonight from across Tennessee and Mississippi, and we thank you for being here and for participating. We love
Delighted.
you so much. Thank you for everything.
Thank you for doing it. We really
Thank you
appreciate
for
it.
keeping the fight going and
Yeah,
not,
bravo.
not stepping back. Bravo for you.
We're
You're
standing on your
warriors.
shoulders,
We're
Dan.
on your shoulders, Dan, 100%. Good night,
Y'all,
everybody.
I'll
Oh,
follow
sorry,
up.
Jess.
You'll get emails, you'll get a video, you'll get link. I'm not going to follow up. Kristen is going to follow up. Let me give credit, but you will get all of this. We're so grateful for you. Sorry, Ashley.
No, thanks,
Bye.
everybody. Good night.
Bye. Keep it on, everybody.
Bye. Thank you.
Thanks, Dan.